Thank you. Access and cost for prescription drugs. Is it time for Canada to enter the 21st century? That's a rhetorical question. Pharmacare for Canada. In 1960, the All Commission recommended universal drug coverage in Canada. In 1990s, National Health Forum recommended first dollar universal coverage for all Canadians. 2002 Romano Commission recommended universal catastrophic drug coverage as a first step towards universal pharmacare. From the Romano Commission to implement the recommendations, there was the National Pharmaceutical Strategy that is about to end, and it totally failed to achieve even catastrophic drug coverage for all Canadians. So in Canada, we still have this hybrid patchwork with the public plans in provinces, some 3 federal public plans as well, a lot of different private drug plans as well. But in the end, people are covered according to where they live or where they work, but not according to their medical needs. What I'm going to do basically in these 12 minutes, overview of Canada's social policy for drug coverage, and then I look at potential reforms. What's going on right now? We have inequitable access and inefficient treatments. The main reason for inadequate treatment and bad compliance is the lack of coverage. Cost-related non-adherence, basically people not filling prescription drugs because of financial reasons. It's 10% of Canadians. Just an example, after a myocardial infarction, medications for free would increase patient life by 1 year on average. The impact on health outcomes is important. And mostly, inadequate drug coverage applies to unemployed workers or workers with unsecured jobs. Most of the people who getting ill can be a financial catastrophe for them. What I would like to focus on is, in fact, incapacity to contain costs. 2011, we spent more than $27 billion in prescription drugs in Canada. Since 1985, on average, prescription drug costs increase every year by 10%. Public spending on prescription drugs in Canada, it's 44%. 38% comes from private insurance. In terms of the importance of private insurers, Canada is second only behind the United States, which is in fact a very important proportion for private insurance. And now 2010, 2011, it's just, oh, well, things are going better. The growth in drug costs is decreasing. Yes, because we had these massive rebates for generics. Yes, because we are in the middle of a patent cliff, but the rebates for generics are over. Now, in terms of the patent cliff, it is soon over. Are we ready for what is coming after that? Absolutely not. We will still fall back in very high double-digit growth in prescription drugs anytime soon. If you look total expenditures per capita on prescription drugs, Canada, it's second behind the United States. Now, is it because we consume a lot of drugs in Canada as compared to other countries? Well, not as compared to many countries like France, for example. In Canada, we just pay way more for our drugs. This is a bit dated, but detailed prices for the same volume of medicines in OECD countries, it includes both the generics and patented drugs. And Canada was second behind Switzerland, but in fact, we were paying more than the United States. The price for generics was huge at the time, but even in spite of the reduction, it is still huge. It's still almost double of what it costs in the United States, even now. Now, what is very important, that we pay a lot of money for drugs, that's one thing. And this is, in fact, not really important. What is important is the yearly growth in cost each year. Now, when you do comparisons, it's a bit complicated. There's inflation, there's population growth. This is real annual growth per capita for prescription drug costs from 2001 to 2010, so the latest numbers by OECD Health data. And basically, there was 2 countries that were doing worse than Canada. It was Greece and Ireland. But because purchasing power simply disappeared in the 2 countries. I just didn't put it in the graph, but we have a serious problem. The system right now is not sustainable. Predominance of private drug coverage, basically, like I said, Canada is the second after the United States. This is the red bar. Why is it a problem with private insurance? Private drug plans are just bluntly inefficient, and it's not necessarily all the fault of private insurers who sometimes try to do the good thing, but when you look in the environment of unionized workplace, problems of negotiating benefits between employers and unions as well, in the end, we have very inefficient private drug plans. Administration markups, 13.2% for private plans as compared to 2% for public plans. Most private plans are administered externally by drug insurance companies, which are paid as a proportion of spending. The idea is that in spite of all the goodwill of many private insurers, in the end, when the financial structure of your business model is organized in terms of you make money, the more there is spending, financially, this is problematic. There is no structural incentive to reduce cost. And another issue is employers get at least 30% in federal tax subsidy. This is in tax credit for private drug plans. This is, private drug coverage, you could say, well, we're not paying for that, so we just don't care. Well, taxpayers paid $1.2 billion for private drug plans right now. This is, I think, simply unacceptable. If we eliminate the subsidy, basically, the whole landscape of private drug insurance would change in Canada. Another reason, because for the waste and for the massive increase in cost, it's the way that we artificially inflate the price of prescription drugs to attract pharmaceutical investment. Now, the thing is, I don't have a problem with innovation policy, industrial policy. It's just, it's not for the provincial health budget to pay the bill to develop industrial sectors. This is not the role of the health budget. Just cost of benefits, something I wrote for Health Canada with Richard Gold. Artificial inflation of costs, if we compare to France or UK that pay 20%, we pay 20% more than France or UK for the price of patented drugs. So if we had price levels at the same range of France and UK, and elimination of 15-year rule that was done last January, basically savings of $2 billion. Now, we artificially inflate our price by $2 billion in order to attract R&D investment. R&D investment in Canada, $960 million, half of which is being recouped through tax credits. We pay $2 billion more to obtain $500 million in R&D investment. There is a serious problem here. So situation now, inadequate access to drug coverage for many Canadians, inefficient treatment due to lack of coverage, and complete incapacity to contain costs. Reform is not an option. The question is, which reform do we want? Based on conventional wisdom, if we continue to all work in silos and basically, how can I balance my little budget? Basically, what will happen is that the reform we'll see, it's increased co-payments, will reduce the amount of drugs covered, will reduce the proportion of population who have access to drug coverage, will increase means testing, so basically more catastrophic drug coverage by increasing deductibles. In the end, we will continue to import US-style policy with US-style results. Massive waste, massive undertreatment, and unsustainable growing cost. If we manage to balance our budget with that, okay. Do we solve the question about sustainability for drug coverage? No. We're just shoveling the problem to out-of-pocket expenditures, but in the end, we will still have the same growing cost. If we adopt reforms supported by evidence-based policy, well, we need collaboration, standardization to overhaul a broken system. We need a national formulary. Product listing agreements, it's not a long-term solution. This is playing one province against the other through whipsawing. This is nonsense. I'm a proud Quebecer, but I know enough about Canada to say that this is unacceptable for Canadians, that we're just playing one province against the other. We need a bulk purchasing agency for generics and brand name drugs. According to PMPRB, 2/3 of the new drugs, well, more than 2/3 of the new patented drugs that arrive on the Canadian market do not bring any therapeutic advance as compared to what already exists. We need a strong health technology assessment to get value for a bucks. Open formulary like we get with most private drug plans is nonsense. If we are ready to pay any price for any drug, basically, don't be surprised that you're not providing financial incentives for drug companies to arrive with real innovation. Well, we also need to tackle irrational prescribing habits caused by marketing-based medicine instead of evidence-based medicine. That's another issue. We need a national drug plan. And most important reform, we need universal coverage for all Canadians to make sure everybody can access to the medicines they need. Universal Pharmacare should not be understood as open bar for everybody. It is a means to develop the institutional capacities to contain drug costs, to achieve sustainability, and improve health outcomes. Just like in every other countries that rationally implemented universal pharmacare already. Private insurance in the health sector is not showing any capacity to efficiently control cost. In the current context, it is not a partner, it is an obstacle to create a sustainable system. First thing we need to do, take back these tax subsidies and use this money in a more rational way. And like I said, it's not the problem of private insurers, it's the problem of the old context. Unions and employers are as much part of the problem than private insurers. So in the last 3 seconds, I still have for the presentation. I wrote a report in 2010, and I continue to stand by the numbers. If we introduce universal pharmacare in a rational way, as an institutional means to develop the institutional capacity to control drug costs, basically we could save easily more than 11% on drug costs in Canada. If we change industrial policies a bit like the UK or France, we could save up to 18%. If we go with a New Zealand-style universal pharmacare, we could save up to 42%. Basically, it shows there's a lot of leeway. The idea with this report, making the economic case for universal pharmacare, was to show it's not a question of cost. It is a question of political will first and foremost. And I just simply think it is time for Canadians to enter the 21st century. Thank you.